Hello, my name is Josh Kruger. I'm a neuro-ophthalmologist at Hadassah Medical Center. This is Shachar, he's one of our medical students. And in this video that we're doing together, we're going to demonstrate my tips for using a direct ophthalmoscope to successfully examine someone.
Lighting conditions are very important, particularly if the patient's not dilated. Obviously, the more light in the room, the more constricted the pupil will be, and the harder it'll be to see the patient's fundus. So if the patient isn't dilated, try to turn the lights down as much as possible.
Okay, I've turned on my direct ophthalmoscope and I have a circle of white light here. The ophthalmoscope has different settings, but it's the circle that I'd like, and you have different sizes of circles. It's believed that it's appropriate to use a circle that's small enough to match the patient's pupil size. So I have my circle set up. The next thing I'm going to do is reduce my intensity of the light to the bare minimum until I can see it. This is very important to keep the patient comfortable and not to use more light than you need to. On my dial here we have the focusing dial, and here I'm going to set it to a plus. There's plus and minus numbers. The plus are usually green, and I'm setting it to a high plus number of about 15. I'm holding with my right hand the direct ophthalmoscope because I'm going to examine his right eye. And everything goes together. If I'm examining his right eye, I hold it in my right hand, and I'm going to hold it to my right eye.
In terms of the patients, we want to ask them to fixate on a distant target. And we want that target to be approximately to the side of our ear. So for example, when I'm examining the patient's right eye, I'm going to have them fixate on a target that will be just to the right of my right ear. From my view, from their view, they would be looking at a target that would be just to the left of my right ear.
The use of your left hand is very important. And what you're going to do is you put your thumb underneath the eye, and then I use my fourth finger or my third finger and put it right on his eyebrow. One of the things that this helps me reassure is that I'm always worried that I might push the direct ophthalmoscope into his eye, and having my finger there I know is blocking me from doing that. I'm extending out my index finger, which is going to make contact and help me stabilize my direct ophthalmoscope. After that, I'm going to now proceed to look through the direct ophthalmoscope and focus in on the iris and the conjunctival vessels and make sure that everything looks normal.
It's very important to be as close as possible to the patient's eye, and the analogy that we can think of is that if we're trying to see what's going on through the hole in this fence, we want to be as close as possible to that hole. It allows us the largest and widest view. If I can see the details of the iris well, then I can presume that the cornea is clear and likely normal. I'll then try to aim the direct ophthalmoscope through the center of the iris, through the pupil itself, and I should see a nice red reflex. And seeing an abnormal red reflex suggests that the patient might have an abnormal lens, and for example, be a sign of cataract. I'll then turn the dial about 10 clicks from where I am about plus 15 in the direction of minus. And at that point, details of the fundus should come into view. And I particularly want to keep adjusting until I can bring the vessels of the fundus into a clear view. At this point, I want to look for the optic disc. When examining or assessing for the optic nerve, it's very important to understand that looking straight back of the eye will not allow you to see the optic nerve. The optic nerve is displaced slightly nasally, and so that means that you have to position yourself slightly off to the side when looking for the optic nerve. When I find the optic disc, I want to first try to assess the rim of the optic disc and ensure that I can see clear borders. And then I want to inspect the actual optic disc itself to assess for things such as color and the size of the cup. And of course, I want to ensure that there are no abnormal features such as hemorrhages. For more advanced users, once you've assessed the optic disc, you can try then to move backward, now outward towards in the direction of the patient's ear, and find the foveal reflex, which would suggest that the patient has a normal macula. For a right-handed person, in terms of difficulty, the easiest task will be to examine a patient's right eye when they're dilated. And that should be the first thing that you should try to focus on excelling at. Once you have a handle on that, then perhaps try to now examine the left eye of a patient that's still dilated. And don't forget that everything has to be reversed at this point. Your direct ophthalmoscope needs to be held in your left hand, and you need to be holding it up to your left eye. When you've mastered that, then go back to the right eye, but of an undilated patient, and then your final challenge would be to examine the left eye of an undilated patient. Again, all this assuming that you're right-handed. If you're left-handed, then everything would be reversed on this slide.
I hope that you found this demonstration helpful. I want to remind you that, like with any skill in life, it's practice, practice, practice. Don't give up after it hasn't worked the first or the second time. Slowly, slowly it'll come, and it's certainly something that can be mastered. I want to thank Shachar very much for volunteering his time to be with us, and also Professor Donchim, who is behind the camera, for making it all happen. Good luck.